After falling, COVID-19 cases are spiking again in some regions, and the fears of a second wave are real. The list of authorities around the world reimposing coronavirus-linked lockdowns is growing. California has banned going to bars and eating inside in restaurants. South African authorities have reimposed a curfew and an alcohol ban. With no vaccine, millions across the world face similar prospects if COVID-19 cases continue to grow. Welcome to your COVID-19 special on DW. I'm Monica Jones in Berlin. Good to have you with us. So experts have been warning of a second wave, saying it would most likely hit in winter. But as we know by now, SARS-CoV-2 is full of surprises. Israel managed the first wave really well, but only weeks later, the country is struggling with a new coronavirus outbreak. Case numbers hit record highs this week.
The new normal. First register your personal details and take a temperature check before you can enter a cafe in Jerusalem. Student Sharon Livney is worried that the number of coronavirus cases is once again rising sharply. She lost her part-time job during the lockdown in March and April. Now she's facing renewed uncertainty.
I'm afraid
of the health issues and the economic situation. Students are getting infected, people my age. It's not only the over 60s. So it's frightening. And financially, I'm still unemployed. I still have to pay my rent. Early on, Israel closed its borders and imposed a strict lockdown for several weeks. At a cost. Unemployment rose from 4% to more than 20%, but schools and businesses started to reopen in May.
A few weeks ago, it looked like Israel navigated its way quite well through the corona pandemic. That has changed dramatically. Special corona wards in hospitals and drive-through testing centers like this one had to be reopened.
These testing stations had closed because there was no demand. Now cars are lining up again. Experts are discussing what went wrong.
There were no strategic preparation, what will happen after the lockdown. And what we see now, the second wave, is really the result of the inaction during the first wave. And it's unfortunate because we were one of the few countries which ended the first wave with 300 deaths, few infections, and we could have revived the economy very well.
Prime Minister Benjamin Netanyahu was widely praised for his handling of the crisis first time round. That has changed. People are worried about a second wave. New restrictions were announced this week, including increasing fines for not wearing masks, limiting the number of people in public areas and restaurants. It feels like a déjà vu for chef Dan Shmulowitz, who had just reopened this fish restaurant in Tel Aviv.
You don't know if you're going to work tomorrow or not. Last time it happened, it was very surprising. This time we are more ready for that, but still the uncertainty is very it's confusing.
Another prolonged lockdown might still be on the cards, a dismal prospect for most Israelis who thought the worst was already over.
And Israelis aren't alone, of course. That threat is omnipresent. How do we deal with that? Stephen Taylor is professor and clinical psychologist in the Department of Psychiatry at the University of British Columbia in Vancouver. And he's also the author of The Psychology of Pandemics, Preparing for the Next Global Outbreak of Infectious Diseases. It's so good to have you with us. Let me start by asking you, how do you cope with the pandemic?
Well, it's important to set a structure for yourself and to set realistic expectations. So we know this pandemic will be eventually over. We don't know when, but you just try and keep on with your life as normally as you possibly can.
So, but some people find that very difficult. What would you say is worse for our psyche in such a situation? Having to deal with an invisible but potentially lethal virus, or having to give up our social habits?
Well, it depends on the person. Some people have no problem giving up their social habits. They're quite happy to sit at home. Other people find it very difficult. So it very much differs from person to person. people are experiencing this pandemic in different ways. For some people, the biggest concern are the socioeconomic impacts, like not having a job. For other people who might have pre-existing medical conditions, the biggest concerns are their physical health.
And what advice could you perhaps give those who really find it difficult to deal with it?
Well, they need to reach out. I mean, for a start, you could reach out to friends and family and connect with those individuals. If that doesn't work, there are internet resources where you can go online and get help for anxiety-related problems. So those sorts of things, it's important to do sorts of planning. There are a lot of resources out there, but people need to go out and look for them.
And well, how big a role does our psyche have in actually spreading the virus? Are we actually contributing to spreading the virus?
Well, viruses spread, it depends on what people do or choose not to do. If the lockdown ends and we go out to pubs and parks and beaches and congregate together, that is going to contribute to the arrival of the next wave. So we need to consider our behaviour. That plays a vital role in the spreading and containment of infection.
Now, Professor Taylor, in our report, we heard, because you touched upon something, our behaviour. In this report, we heard that Israel hadn't prepared for the time after the lockdown. So what lessons can be learned? What could or should we do that at least we can prevent the second wave or deal with it better?
Well, we need to understand from a start, it's very difficult to predict how things will unfold. There are a lot of uncertainties. And what's going to make it easier for people who have to go into a second lockdown, if health authorities can use the modelling or use the lessons they've learned from the first lockdown to try and predict how long the second lockdown will last, that's going to help people cope. If people are told, OK, you've got to be in lockdown for, say, 6 weeks, that's going to be a lot easier for them to deal with than if they didn't know how long they're going to be in. So making this whole experience more predictable, more controllable is going to ease the stress on people and therefore make it easier for them to comply with lockdown.
All right, Professor Stephen Taylor there from the Department of Psychiatry at the University of British Columbia. It's certainly learning by doing. Thank you so much for your expertise and your time.
Thanks very much.
Well, I'm sure you have many, many more questions, and now is the time for some more of those. Our science correspondent Derek Williams stands by and ready to give some answers.
Can a mother who is asymptomatic breastfeed?
It must be terrifying for the mother of an infant to test positive for COVID-19, whether she displays symptoms or not, because the relationship is such an intimate one physically that it seems highly unlikely that the baby won't contract the disease as well. Despite the threat, though, both the WHO and most national health authorities urge mothers who have tested positive for the disease, whether they're symptomatic or not, to continue to breastfeed, because the benefits of breastfeeding and skin-to-skin contact between mother and child substantially outweigh any risks associated with COVID-19 for the child. So it still isn't 100% certain that breast milk always remains completely free from the virus, but the evidence indicates that it's not really spread that way. Mothers who test positive should, however, follow a list of precautions to try to prevent passing the virus along to their baby. If this is an issue for you, I recommend really taking the time to read the much more extensive information posted on the WHO and CDC websites. It can actually help calm your fears, especially to learn that most newborns and infants who get COVID-19 have mild or no symptoms and will eventually, as far as we can tell, recover fully.
So why do most infected newborns recover easily?
We aren't certain why there are so few reports of babies with severe cases of COVID-19, because that isn't the case with other respiratory diseases like influenza, for example. But there are several hypotheses. It could be that differences between the infant immune system and the adult immune system are playing a role. Babies have higher numbers of some virus-killing immune cells than adults have. Infant immune systems are also less likely to plunge into dangerous cytokine storms. And don't forget that kids are not yet saddled with all this sort of baggage of comorbidities that we acquire in the course of our lives, things like heart disease and diabetes. A more contested school of thought says that because babies have fewer ACE2 receptors, which are those receptors that the virus uses to get into the cell, that's having an effect on disease severity. But whatever's causing the phenomenon, it's really not the first time that we've seen it in connection with a coronavirus. Children were also less affected during the SARS and MERS epidemics.
And you can post your questions to Derek on our YouTube channel. If you'd like to keep up with the latest developments on the coronavirus, do subscribe to our newsletter. Just log on to dw.com corona-newsletter. Well, second wave or no second wave, staying safe is a good policy in any case. Now, one couple in Brazil is doing so in style. Once they get their spacesuits on, they're ready to take on the world. Tercio Galdino and Alicia Lim are both in their mid-60s and are in high-risk groups. They hope to send a message with their gear that everyone must protect themselves, especially in countries hard hit by the coronavirus, like Brazil.